students. In this session, we will learn about emergencies, rescue, and first aid procedure. By the end of this unit, you will be able to know about basic first aid techniques during electric shock, burns, and choking. Know about CPR process. Know about bandaging process. Electrocution. An electric shock happens when an electric current passes through the body. This can burn both internal and external tissues and can cause organ damage. Aside from the source of the shock, several other factors affect how serious an electric shock is, including voltage, length of time in contact with the source, overall health, electricity's path through the body, type of current. An alternating current is often more harmful than a direct current because it causes muscles spasms that make it harder to drop the source of electricity. If find someone is suffering from electric shock, approach with extreme caution and follow the first aid steps. Don't touch the victim getting the electric shock because you could also get shocked too. Take the suffered person away from the electricity source as fast as possible. Turning off the electric supply of the machine is the best method for doing this. If you can't move the source of electricity away from the person using a non-conducting object, wood and rubber are both good options. Stay at least 20 feet away if they have been shocked by high voltage power lines that are still on. Call the ambulance if victim is unconscious. Give first aid to victim till the time the ambulance is coming. If the person is showing signs of shock such as vomiting or becoming faint or very pale, elevate their legs and feet slightly unless this causes too much pain. First aid victims in case of bleeding, burns, choking, electric shock, poisoning, etc. Shock. Don't give anything for eating or drinking to the victim. Use blankets or clothes to keep the victim warm. Place the victim's leg on a pillow. Bleeding and wounds. Cover the wound by a clean cloth and gloved hand. Then apply firm and steady pressure on the wound for 5 minutes at least. Lift up the injured leg or arm above the victim's heart level. Secure the wound by bandage when bleeding stops. Ensure that bandage is not fixed too tightly. It may stop the blood circulation. Check the victim of shock. Burns. Chemical or compressed gas burns. Use a drench hose and emergency shower for at least 15 minutes to rinse away all residue of chemicals. Cover the burn by a clean and dry cloth or special dressing for burns. Check the victim for shock. Heat or electrical burns. Cool burning of skin by water. Place the burned area under cold running water if the skin is not broken and gently compress the wound by hand. Bandage the wound by a dry and clean cloth. If blister appear, don't try to break it. Do not apply ointments or cream. If skin is cracked or if injuries are severe, do not clean the wound or remove embedded clothing. Cover the injury insecurely with a clean or dry cloth. expect shock and treat accordingly. Choking. Choking occurs when an object or food becomes lodged in the throat or windpipe, blocking airflow. The main symptom is an inability to breathe or talk. This may accompany coughing. First aid for choking. Wrap up your arms around the stomach and stand directly behind the victim. Just above the navel and well below the ribs, make a fist by hand. Place the fist with the thumb and forefinger side towards you. Hold the fist by your hand and pull it rapidly towards you by slightly upward and inward thrust. If required, repeat it. If the patient becomes insensient, put down the patient on their back. If the object that is obstruct the airway is noticeable, reach a finger into patient's mouth and try to bend the obstruction out of the patient's throat, being careful not to push the object deeper into the patient's airway. Even if this is not successful, attempt rescue breathing. A chest compression (CPR) is more helpful if the victim is still not breathing or moving. Basic techniques of bandaging. Make sure the person is comfortable. Never lean across their body and ensure that you are working from a side of the injury. First, clean the wound and apply the antibacterial cream over it. When the bandage is on, always remember, keep the injured part of the body supported in the position it will be in. Always use right size of the bandage. To check the passage easily, do not cover fingers or toes when bandaging a limb. Never wrap the bandage tight and secure the end by folding it over and bringing a knot in the end. Safety pin, adhesive tape, or a bandage clip can be used. Artificial respiration and the CPR process. Check the victim, tap and shot to get response. Circulation, pump the chest 30 times. At the center of the chest, put the heel of one of your hand and your other hand on the top of it. At a rate of 100 per minute, 16 compressions in 10 seconds, press chest down 2 inches. Tilt head back, lift chin up to open airway. Breathing, tweak nose closed, take a normal breath, cover patient mouth with your hand and blow out your breath until you see the chest rise. 1 breath per second. Again, open the airway if chest doesn't rise. Repeat the procedure until help arrives or the victim starts breathing. Correct method to move injured people and other during an emergency. Stand on either side of the conscious victim. Grab the victim's wrist with your hand close to the victim's feet on your side. Assist the victim to his or her feet and place the arm around your shoulder if possible. Place your free hand around the person's waist and let him or her set the pace on hobbling out. Help the victim to move slowly. This session ends here. Let us have a quick recap before we proceed to the next topic. After studying this unit, the participants will be able to provide basic first aid during electric shock, burns and choking, perform CPR, Perform bandaging. Move injured people during an emergency.